Do you wake up in the morning with the desire to vomit and with the feeling of having an empty stomach? Do you feel that you fill up quickly and your abdomen swells when you eat something? Be careful, it could be gastritis. To watch the Spanish version of this video, you can find a link in the description box. Gastritis is the inflammation or erosion of the inner lining of the stomach. Due to its duration, gastritis is classified into acute and chronic. The first begins suddenly and lasts for a few hours to a few days. The second is long-lasting and if left untreated can persist for years or even a lifetime. Due to the type of lesions it produces, gastritis can be erosive or non-erosive. In erosive gastritis, the lining of the stomach wears away and erosions or ulcers form. In non-erosive gastritis, there is inflammation of the stomach lining but no erosions or ulcers. The most common causes of gastritis include Helicobacter pylori infection, damage of the lining of the stomach leading to reactive gastritis, and an autoimmune response. Helicobacter pylori is a bacteria that infects the stomach and causes most cases of gastritis. The infection usually begins as an acute gastritis in the stomach antrum and causes intense inflammation. If not treated properly, over time it can spread to the entire gastric mucosa and become chronic gastritis. Helicobacter pylori infection is usually acquired in childhood and it's estimated that 50% of the world population is infected, but the vast majority don't develop significant clinical complications. On the other hand, some people suffer from reactive gastritis, which consists of an acute or chronic injury to the gastric mucosa that can cause erosions with little or no inflammation. Causes of reactive gastritis include frequent consumption of non-steroidal anti-inflammatory drugs such as ketorolac, acetylsalicylic acid, and naproxen, intake of alcoholic beverages, presence of bile fluid reflux, and reaction to stress caused by traumatic injuries, serious illnesses, and major surgery. For its part, autoimmune gastritis is a typically non-erosive chronic gastritis. In this case, the immune system inappropriately attacks certain types of healthy cells in the stomach lining, leading to inflammation and atrophy of the lining. Surprisingly, most people with gastritis experience no signs or symptoms at all, but when they do occur, they can include a feeling of empty stomach, burning or pain in the upper abdomen, nausea, vomiting, and belching mainly. In addition, erosive gastritis lesions can cause gastric bleeding, the symptoms of which may be accompanied by shortness of breath, dizziness or fainting, vomiting red blood, black stools, weakness, and paleness. In general terms, acute gastritis doesn't produce complications. However, in rare cases, acute stress gastritis can lead to severe gastric bleeding. On the other hand, complications of chronic gastritis can include peptic ulcers, which are sores that affect the lining of the stomach or duodenum, atrophic gastritis, which occurs when chronic inflammation causes loss of the stomach lining, anemia caused by chronic bleeding from the stomach in cases of erosive gastritis, and neoplasms in the lining of the stomach, as chronic gastritis increases the probability of developing tumors, benign or malignant, in the gastric lining. The diagnosis of gastritis corresponds to the doctors who suspect the disease based on the clinical history and physical examination of the patient, and the unequivocal confirmation is established by means of a gastric biopsy. And here comes the good part, the treatment of gastritis, which includes simple general measures and natural home remedies. The general measures are intended to eliminate the causes that give rise to gastritis and include: don't overdo it with food. It's recommended to make at least 3 meals a day without fail at other times. Don't drink caffeinated coffee, carbonated soda drinks, or alcoholic beverages. Eliminate or minimize the consumption of pain relievers that irritate the stomach, such as non-steroidal anti-inflammatory drugs. If an analgesic is required, acetaminophen will be preferred. And finally, reduce stress, for which the corresponding professional support should be sought. Let's now talk about the 5 best natural home remedies to eliminate gastritis. These formulas inhibit the growth of Helicobacter pylori, promote digestion, and eliminate heartburn, nausea, and abdominal cramps. Due to the particular characteristics of different people, the therapeutic response to these remedies may be different between them. Therefore, each one can choose the remedy that they like best or the one with which they feel better. Here they go. Take note. 1. Ginger juice. The ingredients required to make this formula are 1 piece of fresh ginger equivalent to 1 or 2 grams of the dried product, 2 carrots, 4 stacks of celery, and half an apple, without core or skin, which can be replaced by melon. Its preparation is simple. All the ingredients are simply passed through a juice extractor, and that's it. 1 portion should be taken before breakfast and another before going to sleep. 2. Licorice tea. The required ingredients are 10 grams of dried licorice root and 1 liter of water. For its preparation, licorice is placed in water and boiled for 3 to 5 minutes. Then the heat is turned off and the formula is left to stand covered for 15 minutes, passed through a strainer, and that's it. This preparation should be drunk divided into 3 doses per day, before or after meals. 3. Cuachalalate tea. Ingredients: 5 medium pieces of Cuachalalate bark or a tablespoon of Cuachalalate powder, 1 tablespoon of dried Glycyrrhiza leaves, 1 tablespoon of Cancerian root bark, and 1 liter of water. Its preparation is the same as that of the previous formula. Once prepared, it should be taken throughout the day as drinking water. 4. Potato use. Its preparation requires 3 medium raw potatoes and 2 cups of warm water equivalent to 500 milliliters. The potatoes are peeled, ground, mixed in the water, and left to stand overnight. The next day, strain the preparation and drink a cup 30 minutes before breakfast and another 30 minutes before dinner. And 5. Aloe vera juice. For its preparation, you need the pulp of an aloe leaf, 1 apple peeled and cored, 1 cup of water, and honey to taste. Mix all the ingredients in a blender and ready. It's recommended to drink a cup daily in the morning. Whichever has been the remedy of choice, it should be taken for 2 to 4 weeks. Of course, the general measures described above should also be followed. If you can't find these products in the region where you live, you can easily buy them online. As a precautionary measure, these remedies are not recommended in pregnant or lactating women, in children under 3 years of age, or in people who are taking anticoagulants. Now, for people who prefer allopathic medicine instead of natural home remedies, the main drugs that reduce gastric acid are the following. 1. Antacids, which are usually made up of different combinations of 3 basic salts, magnesium, aluminum, and calcium, together with hydroxide or bicarbonate ions to neutralize stomach acid. 2. Proton pump inhibitors, which decrease gastric secretion by inhibiting the proton pump located in the gastric parietal cells. The main of them are omeprazole, lansoprazole, and pantoprazole. And 3. H2 blockers. These inhibit acid production by blocking histamine H2 receptors found on the parietal cells of the stomach. Famotidine and cimetidine are examples of this. Regarding the specific treatment of the underlying cause, when gastritis is caused by Helicobacter pylori, the triple therapy scheme may be indicated, which consists of the administration of a proton pump inhibitor, for example, omeprazole, clarithromycin, and amoxicillin. In this scheme, amoxicillin can be substituted for metronidazole in patients allergic to penicillins. In the event that triple therapy fails, quadruple therapy consisting of a proton pump inhibitor may be indicated: bismuth, tetracycline, and metronidazole. Whichever scheme is chosen, it should be administered for 2 to 4 weeks. As for reactive gastritis, risk factors should be avoided. For example, if the cause is prolonged use of non-steroidal anti-inflammatory drugs, they should be discontinued and analgesics changed. In the case of stress gastritis, the corresponding professional therapy should be indicated. But be careful. In all cases, It would be the doctor who determines the drugs to be taken as well as the doses and duration of treatment, according to the particular characteristics of the patient and the disease. We end with some necessary recommendations to avoid recurrences. After the basic treatment, at least 3 meals a day should be taken, and in addition, the following foods should be regularly consumed, which in addition to being nutritious, they are delicious. Probiotics. Some of the foods that contain them are natural yogurt, water or milk kefir, raw cheese, and dark chocolate, among others. Vitamin C. Some of the fruits and vegetables with more vitamin C are melon, citrus, and red fruits. These foods improve tissue regeneration from an increase in collagen synthesis. However, there are people sensitive to them in whom gastric pain increases. So, in these cases, it's recommended to check tolerance before definitively removing them from the diet. Vitamin E. Foods rich in these are nuts, for example walnuts, almonds, and hazelnuts, and seeds such as sunflower, sesame, and flax. Banana and pear juice. Stomach cells create a thicker barrier against acid when these fruits are consumed, and banana and papaya juice, which can also be taken with natural yogurt or skimmed milk. And that's it. Let's enjoy life without gastritis.